Good evening, all of you. We are again live with another session. A very important aspect, a very important topic today. I think all of us need a good sleep, and if we don't have a good sleep, things will not be in that manner it should be in a day. So, and cannabis have already proven and shown excellent effects on many aspects as far as sleep is concerned. Today, we will be discussing on various aspects of cannabis, the therapeutic effects on sleep, and we have Dr. Prashant Jain from Nirmal Ayurveda talking on this aspect today, and he is already doing very well in terms of medical cannabis practice is concerned, and we are very much pleased to have him on another session as far as this particular topic, cannabis therapeutic effects on sleep is concerned. And we are very much again thankful and pleased to have Jahan Peston Jamas from Bombay Hemp Company, is one of the founder, and Boheco is always looking forward to spread ethical awareness and guidance across medical cannabis in this particular domain. So we again congratulate and appreciate Bombay Hemp Company, the entire team, Jahan and like other people in the team, that you all are very much interested in spreading this particular knowledge, the technical know-how to groom, to train professionals, and to spread the ethical knowledge across the community and society as well. So again, we are here with you, and due to this, we are able to do this particular session today. I think Dr. Prashant is just joining again. Maybe he's having some technical issues. Meanwhile, talking on the sleep, so there are two, three aspects which we need to understand. First is induction of sleep, means if somebody is not able to sleep and they want to sleep, and we have to induce the sleep in any patient of insomnia. So there are several options available in many pathies. However, as far as cannabis or medical cannabis is concerned, this is one of the safest option to start with in terms of inducing, and very quick from the day one, patients have responded that they are able to get a good quality sleep. Quantity and quality, two things are there as far as any sleep is concerned, and cannabis works on both aspects, quality as well as quantity. So, and prior to that, inducing. So if somebody is not able to sleep, it will help in inducing that. It will, if somebody is having short span, or maybe they are sleeping for just a couple of hours, it will increase the duration also. And third, the quality. So as far as the REM aspects are concerned and other aspects are concerned, if somebody has PTSD, somebody has negative thoughts, or maybe those kind of dreams where they are getting awake in night or they are not able to sleep well, on all those aspects, this particular plant, this particular herb works very effectively. In various research studies around the world, it has been proven that it is one of the few herbs, one of the few plants which is capable of converting your negative thoughts and negative aspects to the positive aspects, hence improving the quality of sleep as well. And also improving the REM also, which is very crucial. The rapid eye movements are very crucial to get a good sleep. And bottom line is, when you are getting awake in the morning, you are feeling fresh, you are feeling light, and you are able to perform your daily day-to-day activities with more energy and more focus. So that is the whole idea of getting good sleep. And we all have anxiety, stress, several mental, psychological disorders which are getting directly or indirectly impacted, and our sleep is getting disturbed in all those aspects as well. And cannabis has been proven to nullify or sometimes heal those psychological disorders as well. So without taking much time, in nutshell, I would like to say that yes, in our clinic and many other practitioners who are like discussing and sharing their feedbacks around the country as far as medical cannabis is concerned, this is one of the top three reasons I can say right now in our country that people are taking medical cannabis, and it is working very well in many patients. In fact, the best part is it is not addictive, and after some time, if somebody is withdrawing or stopping also, their sleep is maintained and they are able to sleep well as well. So it's not that you are getting addicted or you are getting dependent on a particular medicine. This is not the case in terms of cannabis is concerned, but yes, it will help you. And in long term studies also, if you take in low dose and maybe sometimes you maintain some gaps and again restart, it will give you overall effect and overall impact on your health also. So I quickly request Jahan Peston Jamas from Bombay Hem Company to have his introductory remark for this session, and then we will hand over the session to Dr. Prashant Jain for his presentation. And I request all of you who have joined us today. So after the presentation, you all can uh, have your answers to your queries. So meanwhile, we will be discussing. You feel free to post your queries in the comment box, in the comment section, in whatever platform. We are already live on Facebook, YouTube, and many other platforms right now. Around 8 platforms we are live. So you can post LinkedIn also, we are live. So you can post your query and comment, and we will be able to handle that after the talk and discussion from Dr. Prashant Jain. So over to you, Jahan. Thank you.
Thank you so much for that, Dr. Piyush. And again, it's a great pleasure to closely associate and work closely with yourself in the Indian Vedas platform. And again, thank you so much to Dr. Prashant Jain for having joined in as part of the series of educating and creating awareness amongst practitioners with both yourselves and with a wealth of experience you've developed in practical, on ground, on hand experiences with patients. I'm sure there are no better teachers or sort of thought leaders who would be able to actually create that awareness for the benefit of Ayurvedic practitioners and their patients going forward as well. Just a matter of quick introduction from our side. Very good afternoon to everyone who is viewing in on all our different platforms. My name is Jahan Peston Jamis. I'm one of the co-founders at Bombay Hemp Company and also the chief strategy officer. As part of our work at Bohico over the last 10 years, we worked across domains of policy and regulation around medical and industrial use of cannabis, clinical and fundamental research around the medical use of cannabis, and actually growing and breeding cannabis. We've actually also initiated some of the first human grade clinical studies in partnership with academic institutes under the Ministry of Ayush. In fact, one of them is around post COVID stress, anxiety, and sleep, particularly using one of our formulations that was devised for stress and sleep, as Dr. Piyush mentioned, at the polyherbal optimization of cannabis with sort of the right concoctions in the Ayurvedic herbs would have a tremendous effect and be able to kind of augment and sort of mitigate the biphasic risk of cannabis, where with low dosing there are better results to achieve as compared to high dosing, where what would have been considered a mild effect becomes an adverse effect. I think as a matter of sort of a brief element, I think it's no coincidence that Ayurveda has spoken about Vijaya's effect in terms of Nidrakara. I believe the sleep inducing phenomenon has been around for centuries. We're very glad that modern science and I would say ancient medicine through Ayurveda have managed to combine in this day and age, where we can actually study this in patients, be able to evaluate how it's helping in sleep, as you mentioned, have objective factors with respect to REM, with respect to early to late morning grogginess, or any other sort of factors that come into play. And it's a great pleasure to be part of such platforms to continue this series of education and awareness by doctors for doctors. And from our side, we're very excited, to learn more and to be able to contribute more through the process of such dialogues as well. So, without any further ado, we'll hand over to Dr. Prashant. Once again, thank you so much, everyone, for tuning in on behalf of Bohico. And of course, once again, thank you, Dr. Piyush and Dr. Prashant, for this opportunity as well.
Yeah. Good evening, everyone. Good evening, Dr. Piyush. Good evening, Jahan. So I once again thank you both of you to welcome me and to introduce me to the Bombay Hemp Company, Dr. Piyush, and Jahan to introduce me to the public that we are here and we are creating awareness among the doctors of Ayurveda and also the public. So who are getting aware related to the medical cannabis and its therapeutic effects as well. So it's a very good thing that Indian Vedas is doing, and we all are here to share the views and especially create awareness among the doctors and public that consuming cannabis or using cannabis medicine is not a taboo. So it's having its own therapeutic effects, and by those therapeutic effects, definitely we can do wonders. And moreover, some people who are getting addicted to some sort of medications for their sleep, that also can be reduced. As rightly mentioned by Dr. Piyush, that consuming cannabis medicines or taking medicines which are prepared out of cannabis doesn't create any sort of addiction. And it's not like that after taking medicines also you have to take medicine regularly. It's not so. Once your treatment is done, you are healed, and moreover, we need not to take the medicine more. After that, it's not like that you need to take the medicine for the sleep purpose. So once it's over, then we can slowly cut off the dosage and we can taper it off, and slowly it will reduce. Later on, you need not to take the medicine regularly for your sleep purpose. So on that note only, I will just proceed further, that how this medicine, how this cannabis, how hemp can be used for the purpose of sleep, to how it will improve the sleep, how it will improve the quality of sleep, how it will improve the sleep disorders as well. So, what we are discussing currently, that medical cannabis for sleep, how we can use it. So, medical cannabis is commonly, very commonly, when we'll see in the day-to-day practice, it is most commonly used for sleep purpose only. The first common use is for sleep. Second common use is for pain. So, it's in the same way also it is being advertised by many medical companies in India and abroad, that cannabis is very good for sleep or very good for pain. So National Academy of Science reports found moderate evidence suggestion cannabinoids can be helpful. So National Academy of Science have conducted many of the researches, and it I am speaking about the initial researches. These is one among the initial researches that they have conducted, and they found that medical cannabis is moderately effective in management of sleep. So whether it is moderately effective, or it is effective, or it is very good in efficacy for sleep disorders or sleep, or we will say for insomnia, that we'll find out very soon, and we will discuss it in detail in the same presentation today. Right. So, but before understanding, we need to understand that why it is important to discuss sleep, or why sleep is important to our body. Because until unless we will be knowing the importance of sleep, or until unless we will be knowing the how sleep works in our body, what are the benefits of a good sleep, why it is very much important to discuss sleep, and why we are discussing this topic specially today, that cannabis and sleep, how we can improve the sleep with the help of cannabis. First, we need to understand the importance of sleep itself. So sleep is involved very much in healing our heart, blood vessels, and moreover, when we are asleep, our body starts a mechanism of uh, healing within. So it is not like we have to take some medicines to heal. Our body starts the mechanism of self healing while we are asleep. The sleep deficits, it will lead to imbalance in the hormones that govern eating, and also associated with obesity. Whenever there is a lack of sleep, our hormones, our complete circadian rhythm will get disturbed, and moreover, it will lead to the eating disorders, ultimately, which will end up in the obesity. Sleep also affects how body reacts to insulin. Sleep deficits lead to a higher than normal blood sugar level, increase of type 2 diabetes. This is one of the reason why we will get obese when there is a deficit of sleep. Moreover, the same thing, as much of blood sugar level would be there, if the blood sugar levels are constantly high, definitely that will lead to reduced your immune system. So your immune system, immune efficacy will get reduced, and there is high chances of getting autoimmune disorders. So sleep is that much essential that it will regulate your heart, it will regulate your brain, it will regulate your blood vessels, it will regulate your immunity, it will regulate your blood sugar levels. If you are having a healthy sleep, you will be having a healthy day to day life cycle, and the sleep is disturbed, then all these things will get disturbed eventually. So in this, I have tried to show the power of sleep, that if there is long time in the sleep, then long gap in the sleep, proper sleep, it will lead to so many of problems, which is one among is sickness, weight gain, infertility, which we are discussing regularly on the other platforms related to the infertility and concerned topics. So all these things will be there if your sleep is not proper. So actually, what is sleep? So sleep is a behavior that follows a circadian rhythm. There is a normal rhythm in our body which will be there morning to evening. Regularly, it will get regulated every 12 hours. This because of this circadian rhythm only we will be awake and we will sleep. So sleep is organized into cycles. It is not uniform throughout the night. Sleep is defined by four behavior criteria: reduced motor activity, decreased response to activity, stereotypic postures, and reversibility. So these are the four behavioral criteria. Your motor activity of the body will get reduced. Your response to the other activities, if someone is trying to awaken you, you won't get awake so easily if you are asleep. Stereotypic postures, your body will make some postures which won't make while you are awake. And reversibility, you will get reversed to the awakeness from that sleep. If you are not getting reversed automatically, then you are not into a stage of sleep. That stage could be of syncope or coma or something else, but that's not sleep. So it is reversible process. It's not a permanent process. The stages of sleeps are stage 1, that is the lightest stage, first stage, that is known as NREM, non-rapid eye movement stage. Similarly, you will be having stage 2, stage 3 and 4 of NREM, and one stage comes in between 3 and 4, that is REM, rapid eye movement sleep. So whenever we see dreams, most of the dreams comes in this REM sleep cycle, and this is accounts for approximately 25% of the sleep. And this is the time when major healing occurs of the body. The brain is not at rest at this time. Brain would be hyperactive. When we'll see the sleep cycle in polysomnography, there would be the spike waves of the break waves increase in this area of REM, rapid eye movement sleep. There would be high neural activity at that time, right? So, sleep apnea. What is sleep apnea? Sleep apnea is characterized by a pause or gap in breathing due to an obstruction of airway. So, while sleeping, all of a sudden, sometimes patient experience that they are getting choked or choking experience would be there, and following which they'll get awake. So that is sleep apnea, and generally it is being seen in the mostly obese patients. The patients who are having hypothyroidism, this neck area will get obese, and in those patients is generally seen. Moreover, other symptoms will be loud and regular snoring, large neck size, and obesity. And it is all mostly associated with major conditions as that of diabetes, hypertension, hypothyroidism, or cardiac issues. Something related to that is mostly, and it is generally seen in patients who are obese. So try to keep your weight under control if you don't want to get choked at night while sleeping, right? And similarly, when we'll proceed further, so we need to understand what is insomnia. Insomnia is not like that you are not getting sleep for 3 or 4 days and you will say that I am having insomnia. No, that's not the criteria to diagnose the insomnia. If you want to diagnose insomnia, if you want to say that you are insomniac or you are having insomnia, or doctors want to diagnose a patient who is having insomnia, then they must follow a regular pattern of getting disturbed sleep almost approximately 3 times in a week for more than a month. Then only they will be saying that they are having insomnia. And the criteria depends upon DSM-5 or ICD-10. They both have different criteria, but at least patient must be having problem more than getting awake or getting reduced sleep more than 3 times in a week, and for consistently for more than 3 weeks, 3 months, or more than a month, then only we can say the patient is getting insomnia. Regularly getting disturbed sleep is a common problem amongst the individuals, amongst the patients who are having regular pain. So that is not insomnia. Insomnia is idiopathic. Insomnia is not associated. Disturbed sleep may be associated with some different complaints as well. For example, restless leg syndrome or pain or some other things. So, but insomnia is idiopathic. So, a perception or complaint of inadequate or poor sleep. So, difficulty falling asleep, frequent awakenings in the night, waking too early and having difficulty falling back to sleep, walking unfreshed, next day consequences like that of your cognition disturbances, unable to focus on the things, unable to drive consciously, getting too much of yawning or daytime sleepiness. These all are the complaints which a person who's suffering from insomnia will get. Apart from that, they may also get these psychological problems, high blood pressure, risk of heart disease, risk of diabetes, obesity, poor immune system, which we have discussed earlier as well. So these are the complications, some common complications of insomnia. So what is that we were discussing the circadian rhythm. So what are the circadian rhythm disorders? This must not be mixed with the insomnia. So, disruption in a personal natural clock that regulates a 24-hour cycle of biological process. That most people will suffer jet lag when they'll travel from the Western countries to the India. That is because of this circadian rhythm disbalance. So, delayed sleep wake phase, go to the sleep late, wake up late, more common in children and adolescents, 7 to 10%. Advanced sleep phase, to go sleep early, wake up early, increase with age. 1% of the middle aged adults will have this thing. Irregular sleep wake phase, irregular sleep wake patterns, non 24-hour sleep wake rhythm, sleep time shifts later each day, shift work disorder, non traditional work schedule, yeah, jet lag when we travel long distances. So, all these things happen due to the circadian rhythm, but these things need not to be corrected with the medicines. They will be corrected by the help of some therapies or just to try to correct your rhythm, then they will come into balance. Sleep deprivation. In humans, sleep deprivation most negatively impacts cognitive performances, especially reaction time. So what we have discussed earlier, when you are sleep deprived or you are insomnia, you are having insomnia, then it will definitely affect your cognitive performances. The effect of sleep deprivation on driving performance are similar to the effect of alcohol. If you are sleep deprived, you haven't sleep at the night and you are driving, so the effect would be as same as that of alcohol. Even I have remembered some of the patients, they said that they didn't slept at the night, and while driving they are asleep. They felt asleep and they actually slept. So these things do happen in common when you are not slept at night. So in the morning hours you feel asleep, and you sometimes you sleep while driving. So if you are not sleep in the night, please don't drive in the morning hours until unless you feel fresh. So, following sleep deprivation, people spend more time in REM sleep. In animal studies, extreme sleep deprivation leads to illness and even death. So, it has been observed in the animal studies that regular sleep deprivations will lead to illness and death as well. So sleep in general population, poor sleep is very common in US. Data from 2014 behavioral risk factor surveillance system on prevalence of healthy sleep duration more than 7 hours in for adults, only 65% reported healthy sleep duration. So you can see since 2014 also the data has been regularly reported, and it has been observed that 65% only have reported healthy sleep, rather less 35% of the people have reported unhealthy sleep. Prevalence of healthy sleep lower in non-Hispanic blacks, American Indians, Alaska Natives, and state-based estimate of healthy sleep duration range from 56% to 71%. Sleep efficacy changes with the age. Sleep efficiency is the percentage of time asleep while in bed. When you'll go to bed, after that, how much time you felt you will pass asleep. So that is the sleep efficiency. Like you went to the bed at 10 p.m., you got sleep at 12, you got up at 6 a.m., and you get out of the bed at 7. So 12 to 6 would be the sleep efficiency. So that changes with the age. Initially, it would be sleep efficiency is higher, and as the age progresses, the sleep efficiency will reduce by nature. So this is very much okay. It will reduce by nature itself. Sleep and pain. Some complaints are present in 67 to 88% of chronic pain patients, like the patients, as we have discussed earlier as well, the patients who are having regular pain in the body, they would be having complaints related to the sleep. Pain contributes to sleep disturbance and makes sleep difficult. Sleep problems significantly increase the experience of pain. Disturbed sleep may impact processes that contribute to development and maintenance of chronic pain. So it will disturb the, if you are regularly having pain, that will lead to again disturbed sleep again will lead to increased pain. So it will disturb your neuroendocrine mechanism and inflammatory mechanism, and again your pain will increase, it will not subside. So the treatment would be for both the things at same time. Sleep and anxiety depression. A recent systematic review looked at the association between sleep, anxiety, and depression. Insomnia and sleep quality were bidirectionally related to anxiety and depression. Sleep problems predict higher levels of depression and a combined depression anxiety variable. Anxiety predicts excessive daytime sleepiness. So if a person is having disturbed sleep, definitely it will lead to anxiety and depression. Moreover, if a person is having anxiety and or depression, it will further impact the sleep. So it is a cycle. If you are having pain, it will improve, it will hamper your sleep. Again, sleep will hamper your pain. If you are having sleep deprived, again it will create the anxiety again it will deprive your sleep or disturb your sleep. So these are the cycles. So whenever we are treating patients who are having problems related to sleep, the root cause must be addressed, whether it is because of the pain or because of anxiety, depression, or any other psychosomatic aspect or somatic aspect, whichever is there, everything need to be addressed, and then final diagnosis must be made, and the attempt should be made to treat both at the same time, sleep and also the associated factor which is causing sleep deprivation. If doesn't find so, then the sleep is itself is a factor and it will lead to insomnia, and the diagnosis of insomnia must be made. Sleep and PTSD. Sleep disturbance is a hallmark feature of PTSD and is also prevalent in veterans with traumatic brain injury. Poor sleep has a negative impact on treatment and recovery of PTSD and TBI. Interventions that help with sleep may also help treatment of PTSD and TBI. So PTSD is basically post-traumatic stress disorder, mostly seen in the veterans, which are like army people or the people who had very bad experiences with the life, the victims of sexual assault, all these patients, all these persons will be having some sort of post-traumatic stress, and they're having different sleep problems. They will generally get nightmares. And similar, the patients who had traumatic brain injury, they also have some sort of PTSD as well, because traumatic brain injury will be like hemorrhage or ischemia due to some trauma. So in those patients also sleep is disturbed, and poor sleep will again increase those conditions. So the treatment, whenever we are planning the treatment must be planned for both the things, for sleep and for PTSD or TBI as well. Common risk factors which will lead to or enhance or increase the insomnia or sleep disorders are: females are having higher rate of insomnia, being over the age of 60, having depression or anxiety, frequently traveling long distances, working night shifts, having a family history of insomnia. And the risk factors for sleep apnea would be: being male are having more cases of sleep apnea, over the age of 40, overweight, family history of sleep apnea, neck size of 17 inches or more, chronic sinusitis problems, or a deviated nasal septum. So these are the some common risk factors which will enhance the problems of insomnia or sleep apnea. Etiology of insomnia: a model of chronic insomnia, like predisposing factors would be biological traits, psychological traits, social traits. Precipitating factor would be further medical illnesses or psychiatric illness or stressful life events. And perpetuating factors would be excessive time in bed, napping, and conditioning. So these could be the reasons why it will lead to insomnia, like we have discussed earlier. So here comes with the insomnia treatment options. What are the treatment options currently we are available with us? Later on, we will discuss how medical cannabis can modify these actions and we can get benefited. So the treatment options would be: avoid drugs that make it difficult to sleep before getting sleep, like caffeine, tobacco, alcohol. Some people would be having heavy habit of taking alcohol for sleep, and they say that until unless they'll take alcohol, they'll not get sleep. Actually, the alcohol won't help you to get a sleep, but it will create difficulties for you for future. Later on, you will get addicted to the alcohol, and without the help of alcohol, you will not get sleep. Moreover, it has been noticed that the patients who are dependent on alcohol for the sleep, actually they won't go into the REM stage of the sleep. They will be having an stage 1, 2, 3, 4. They won't enter in the REM stage of sleep, and so that they won't get complete relaxed sleep. Adopt habits that make it easier to fall asleep and stay asleep. Wind down routines, books, music, hot bath. Exercise regularly but not 5 to 6 hours before going to bed. No heavy meals before bed. Avoid bright light and limit possible distractions in bedroom like TV, laptop, tablet, phone. Make sure bedroom is dark and quiet. Go sleep around the same time each night and wake up around the same time in the morning. That will regulate your circadian rhythm. What the circadian rhythm disorders we have discussed earlier, this will regulate the circadian rhythm and make it a fixed rhythm, so that you can get sleep at the same time daily and you will wake up from the bed at the same time daily. So next, the insomnia treatment options with the medications. Currently, we have benzodiazepines, non-benzodiazepines like that, which have side effects include daytime drowsiness, drug feeling, weird stuff. Over-the-counter melatonin side effects includes headache, dizziness, and drowsiness. So with the medications, you will be having some sort of side effects. Other treatment options for the sleep apnea would be CPAP machine. Continuous air pressure keeps airway from collapsing, and no serious side effect, but can be uncomfortable to use, and adjustment can take some time. So there would be a machine which by which you will get regular flow of air, and this will prevent to get blocked, and you won't choke. But it will take time to get adjusted with that machine. Treatments for circadian rhythm disorder would be melatonin, behavior therapy, and light therapy. Treatment challenges: effectiveness of most treatment is modest at best. Most treatments only treat symptoms rather than the root cause of the sleep problem. As we have discussed earlier, we need to find out the cause of the treatment, cause of the problem, why you are getting deprived of sleep, and then we have to treat it. It's not like we can just start treating the patient without diagnosing it correctly. So medication या treatments often have serious side effects: burning, tingling, dizziness, daytime drowsiness. You will be having all these side effects when we'll consume the medications. In general, etiology of sleep disorder is not well understood, make it difficult to develop new effective treatment options. So till now also, when we will say that sleep disorders or the problem of insomnia or obstructive sleep apnea or other things, why patient is not getting sleep. So in that case, the exact root cause has to be find out why patient is not getting sleep, how we can improve it. So that is the main reason why we are not able to find out the exact medical treatment by which can help a patient, or like if a patient is having insomnia, just give this medicine, his sleep will improve. Nothing like that. If you will take the medication, that will definitely come with the side effects. That's why we are discussing here, and we have found out some new medications which is definitely helpful and which will induce sleep without any sort of side effects and no without any addictive nature as well. So the endocannabinoid system and the circadian sleep wake cycle, which we will discuss now, that how this endocannabinoid system is helpful to regulate the circadian sleep cycle. So endocannabinoid system is the cannabinoid system which is present inside the body, and we need not to induce it, and but just we have to activate it. So and ECS or endocannabinoid system is involved in regulation of circadian sleep wake cycle, maintenance and promotion of sleep. ECS may be linked between circadian regulation system in the brain, that is suprachiasmatic nucleus, and behavioral or physiological process. Lack of normal sleep causes dysregulation within the ECS. So endocannabinoid system will regulate your suprachiasmatic nucleus, and it will give indication to that which will further induce the sleep. When you have deprived sleep or your sleep is not regulated regularly, your ECS will get disturbed, and vice versa. When your ECS will get disturbed, your sleep cycle will get disturbed. So elevation in the ECS at a receptor level is involved in recovery of sleep after non-normal sleep. So if you are not having regular sleep, your ECS will get disturbed. But once we'll activate this ECS, once we'll activate the endocannabinoid system of your brain, then definitely it will again improve the sleep cycle, or it will again improve the quality and the quantity of sleep. So the cannabis and sleep, when we'll speak about the researches which has been done on cannabis and sleep. So research on the impact of cannabis on sleep started in early 1970s and included number of studies examining polysomnography based sleep studies. Polysomnography, when we'll do in the patient, that will give exactly that how much patient, for how much duration patient was in stage 1, 2, 3 or REM or stage 4. So that is the gold standard, and initial work suggested cannabis may have short-term benefits on sleep. So that was the initial works. Initial work examining in specific cannabinoids suggests a potential therapeutic effect of high dose of CBD combined with low dose of THC for sleep. Cannabinoids and the sleep-wake cycle, when we'll speak about, the recent research suggests sleep outcomes depends on type and the ratio of cannabinoids, THC, CBD and others, dosage, timing of administration, route of administration. Current research focusing on self-reported sleep, examining potential therapeutic impact of cannabinoids for sleep. These are the current research which are going on. So by all these things, by all the research from 1970s till now, what we have found out that the sleep, sleep depends upon how you have to give the CBD or cannabinoids or cannabis, and what would be the dosage, timing of administration and route of administration. These things has to be calculated based on the presentation of the patient. Like you have to see at what time patient used to go to the sleep, and how much time before that you have to administer the medicine, how to administer the medicine to gain the maximum efficacy of the medicine, and at what time and in which right dosage for that patient. It's not like if you'll give high dosage patient will get sleep. No, patient won't get sleep. In spite of that, he will develop some sort of paranoia. So it's not like you can give very much higher dosage of the medication, patient won't get sleep, he will feel dizzy, he will feel some sort of vertigo or paranoia effect, or patient, sometimes I have personally seen patients who were not getting sleep and they have taken higher dosage of the medicine, they have developed some sort of effects. So right dosage is very much important. If you give the medicine in right dosage, that is very very efficacious. But the same thing when it is given in wrong doses, sometimes patients, they take the medication by themselves without proper guidance or without consulting the practitioner. So once again, in the each and every time, I request our viewers, patients, doctors, everyone, that don't take any medication by yourself. please take the help of your medical practitioner. If you are taking Ayurveda medicine, please consult the Ayurveda doctor before taking any medicine. If you are taking any allopathy, homeopathy, or any other Unani system of medicine, any medicine, whichever you are taking, please take under the supervision of a registered medical practitioner of that particular pathy itself, because everyone have their own command in their specific qualification, in their specific domain. So it is not like a person who is from other domain can prescribe any medicine. So please take this in consideration. And whenever you are taking any medicine, it's not about cannabis, it's not about rasaushadis, it's not about some Ayurveda no, herbs, it's not about ashwagandha, giloy, anything. Whichever medicine you are taking, take that medicine under proper medical supervision only. Don't take medicines by yourself, because each and everything, when it is given in right dosage, right timing, right duration, it works as nectar, it works as amrit for you. But the same medicine can become poison for you if it is taken at wrong dosage, wrong time, wrong route of administration. So please take every medicine with the help of medical practitioner only. Similarly with the cannabis when taken in right dosage, right time, right form, right duration, it will work like wonders. You can't even imagine. But at the same time, when you take the medicine by yourself and you will take the dosage irregularly, definitely it will give you some sort of other results as well. So CBD and sleep, what is the relation between that? CBD has differential effects on sleep based on dose. Like we were discussed, low dose CBD does not improve sleep at all, but the high dose CBD does improve sleep. In people with insomnia, 160 mg per day of CBD increase total sleep time and decrease the frequency of nighttime arousals. Like frequent awakening, repeated awakening in the night time after getting sleep has been seen reduced. The reference of the research has been mentioned on the baseline, so you can refer for the same. Cannabinoids and insomnia sleep quality increased in total percentage of sleep in rats after administration of medium to high dose of CBD. CBD blocks anxiety induced REM sleep suppression, no effects of NREM sleep. CBD may impact sleep via decreasing anxiety. CBD may decrease stage 3 sleep when used with THC. THC decrease sleep latency. Contradictory finding in whole plant cannabis users. No surprise gives that cannabis and the terpenes in the flowers. So whatever the studies has been conducted, those has been conducted with CBD and THC, and that too high dose of CBD and low dose of THC. So it has been found that when the CBD is given in high dosage, that definitely that has improved the sleep, and THC when it is given in the low dosage, it has improved the sleep latency. So when both has been given in combination, they have given very good results. Similarly, when we found out cannabis in the obstructive sleep apnea in rat models, endocannabinoids and cannabinoids modulate respiration during sleep. So what we have seen that what we have discussed earlier as well, when you have reduced sleep, your ECS endocannabinoid system will get hypo, so it won't respond. But when we initiate the endocannabinoid system with the help of cannabinoids, it will again improve the sleep quality. Cannabinoids may suppress the serotonin mediated symptoms in OSA, obstructive sleep apnea. In human research, it has been seen that endocannabinoids may protect brain from sleep apnea. Synthetic THC, dornabinol, has also associated with improvement in apneas. So, obstructive sleep apnea is qualifying condition in MN, but medical community has against it. So there was some sort of opposition every time. Another important aspects of improving sleep, using cannabis to improve sleep can directly improve outcomes related to the other conditions that are associated with or exaggerated by compromised sleep. So what we were discussing regularly, if your sleep is compromised, definitely it will improve, it will increase the pain. Again, when pain will get increased, it will again increase the sleep, it will again disturb your sleep. Similarly with the anxiety or with the depression or with other medical conditions, because deprived sleep will increase the inflammatory markers, so will increase the inflammation inside the body. Once the body inflammation will increase, again it will cause disturbance in all your systems. So, exaggerated or compromised sleep, chronic or acute pain, pain tolerance, pain sensitivity, these will increase. If your sleep is reduced, then pain tolerance will reduce, pain sensitivity will increase, anxiety will increase, PTSD will increase, opioid use disorder will increase, other addictive disorders like alcohol use will increase, If your sleep is getting disturbed regularly, your day-to-day alcohol consumption will get increased eventually. Likewise, if cannabis alleviates symptoms of these disorders, it may also increase sleep. So cannabis, when we give it to the patients, when it will increase the sleep efficacy, when it will increase the sleep of the patients, it will also subside all these symptoms as well. So how to use cannabis for sleep? This is the main reason why we are all here, and we all would like to know that how you have to use cannabis, how you have to prescribe the cannabis to improve sleep. So recommendations from medical patients who want to try cannabis for sleep and the for doctors who want to prescribe cannabis for sleep is start low and go slow with product that contain THC. Combine higher dosage of CBD with low doses of THC. Use lowest dose of THC possible to achieve desired effect to reduce tolerance and withdrawal. Do not combine with alcohol or other medications. So it should not be combined. Moreover, when we'll speak about the in India, this format generally is not possible because we have full spectrum CBD oils, full spectrum in the sense we won't segregate CBD and THC. But when we'll see CBD and THC ratio, mostly we will find that the CBD and THC ratio in the full spectrum, what we'll get is more of a CBD side. CBD is higher in percentage as compared to THC. So it is one of the same, but we won't change those concentrations currently. Hopefully, in the future, we would be able to change the concentration and adjust it. But full spectrum is always better than that of the isolates, and that's why it will give very good efficacy in the treatment aspect as well. So, based on all these things, what we have found out, additional research needed to determine how if cannabis should be prescribed for sleep. Lots of claim made by the cannabis industries, but currently we don't rely. It completely depends upon the patient's present status. It is not same for each and every patient that you can do in this much dosage. That's why we have to start low. We have to start with the minimum dosage as per the height and weight of the patient, as per the chronicity of the disease, as per the underlying medical condition of the patient. We have to see each and everything. What is the underlying medical condition? Does patient have any sort of another psychosomatic, somatic, or psychological issues associated with insomnia? What is the height and weight of the patient? Depending upon all these things, we have to make a minimum dosage, as we say in the Ayurveda, that yuktistu yojana yatu yujyate, that whatever your yukti, based upon the yukti of the physician will decide the specific dosage for the patient. With the minimum dosage we will start, and regularly we can tighter the dosage, or we can increase the dosage, we can modify the dosage as per the requirement of the patient. So there is no fixed dosage that this is the fixed dose or this is the dose which has to be given for the patient for sleep. It is not so. Each and everything has to be evaluated. Based on that only we can give the medicine to the patient. So the conclusion, preliminary researches suggest CBD may have therapeutic potential for insomnia. THC may decrease sleep latency but could impair sleep quality for long term. If there is a very much high dosage of THC as compared to CBD, then it may also, this is a hypothesis, this is not a conclusion. So it may also hamper the quality of sleep, but definitely it will reduce the sleep latency. Evidence suggests usefulness of high CBD combined with low THC. Cannabinoids may improve sleep in chronic pain patients, PTSD patients, and others. So the questions arise here. Do cannabinoids have an indirect effect by improving sleep, or does sleep improve secondary to improvements in other symptoms, or both? So whenever we are prescribing a medicine based out of cannabis to a patient, so how does it act on the patient? Whether it act on the basis that it will reduce the sleep, it will improve the sleep, and it will reduce other symptoms, or it will reduce the other symptoms, it will act on other symptoms and reduce and improve the sleep quality, or it act on both. So as we have experienced particularly in our clinical patients, that when we'll prescribe medicine based out of cannabis to a patient, then definitely patient will experience changes in all the domains. But it is not so that patient who are having pain, so if their sleep is also sound, when we'll give the medicine for pain, their pain will reduce. Similarly, patients who are having anxiety, but there is no disturbance of the sleep, then anxiety will reduce. Similarly, I have seen some patients who are having proper idiopathic insomnia, that they were not having any other sort of disorder as that of pain, anxiety, depression, or other symptoms, but they are having proper insomnia. When the medicine has been given to those patients with the medicine based out of cannabis, their insomnia have improved, their sleep quality have improved. So the quality of life based out of the sleep, disturbed sleep, has also been improved. So we have seen practical differences in the patients that has also been documented well. So I can say that the medicine which are based out of cannabis, when we prescribe to the patients, it will have the holistic approach. It will have the holistic effect on the patient. So this is one such medicine which works wonderfully, and you need not to prescribe different medicine for pain, different medicine for anxiety, different medicine for the depression, different medicine for sleep. Rather, you will prescribe only one medicine which will encounter all the problem of a patient. So that is the conclusive remark for today's session, that one medicine, one single medicine based out of cannabis, which is suitable, suggest to the patient, do the analysis of the patient completely, what all the differences, what all the diagnosis patient have, and accordingly plan proper medication based out of cannabis, which will benefit in all the domains. So need not to prescribe so many medicines, rather concise your prescription to one or two medicines. Definitely the medicines which are based out of cannabis works like wonders. So thank you all for listening so patiently. If you have any queries, you can ask. Definitely we will try to resolve those queries of yours meanwhile. Yeah.
Thank you, Dr. Prashant. Again, it was an excellent session, and you have covered majorly all the aspects. Jahan, you want to add on something to the discussion, or we shall proceed
Uh,
for the queries?
no, I don't think so, Dr. Piyush. In fact, I think one of the elements that we've learned, and especially of the tail of the entire voluminous exercise of global clinical information that Dr. Prashant has shared. One thing we've really understood is how. The culture of benzodiazepines, SSRIs, SNRIs is not inherent within the Indian medical and healthcare system, where because of the side effects and adverse effects, we've had a lot of patients whose Ayurvedic practitioners have helped them successfully wean off clonazepam and other benzodiazepines in the process. So, I think this has been an enormously educative session, even for ourselves, to learn directly from Dr. Prashant and sort of his entire extensive research around how the topic of sleep with cannabis and even sleep from a general perspective as
Right, great. So we have certain questions as well, as far as this particular topic is concerned. So the first question from Dr. Surbi is: does it have any effect on heart rate? We can administer in elderly patients with low pulse rate as well.
Yeah.
You want to take
So
it,
when
please,
we
Dr. Surbi?
Yeah. Okay. So, Dr. Surbi, yes, definitely. When we'll see about the cannabis, so on the heart rate, if you'll see the patients who are having uh, anxiety, generally they will be having some sort of high pulse rate. So they won't have low pulse rate. But at the same time, when we'll see patients with the depression, their pulse rate is actually very low. So in both the cases, it can work. But the thing is that you have to monitor the patients, and the dosage has to be selected accordingly. Moreover, the sattva of the patient has to be assessed at this particular age and the particular disease rate what you are speaking about. If the patient is having our sattva, first a detailed explanation related to the cannabis has to be given to the patient. The patient has to make understood that how the medicine is going to work. Otherwise, definitely person will feel that okay, I have consumed some medicine made out of cannabis, and they may have some sort of panic. So first thing you have to do, that you have to address the patient, you have to guide the patient with the medicine, and you have to assure the patient with the safety of the medicine, following which you can definitely prescribe the medicine to the patient. Like we said, start slow and the go slow. So start low, go slow, start with the minimum dosage, monitor the effects, and later on again you can modify the dosage based out of that.
Okay, great. And the next question is: how long will it take to start working?
So as far as the dose medicine effect would concern, the medicine effect would be seen as in the same day when you prescribe the patient, and on the same day it would be seen the effect of the medicine. It depends upon that, if the right dosage has been given to the patient, on the same day the effect would be seen. Next, as soon as you will modify the dosage, the patient reach on the exact dosage, on that day also the effect would be seen. So it depends upon the dosage of the medication, that how much dosage a person requires, on that basis the result would be seen. But definitely on the very first day when we will prescribe the dosage, the medicine to the patient, on the very next day patient may experience some sort of difference in the sleep, and when he'll wake up in the morning, the difference in the sleep pattern will be noticed.
Fine, fine. And can it be given to hypertension and IADM or any other cardiac cases?
Dr. Pavan, definitely it can be given to hypertension or IIDM, insulin or the cardiac cases, but it has to be given very precisely, very cautiously, and everything has to be monitored on the root level. It is not like we will just prescribe it and we will leave it. The everything has to be monitored, and very cautiously if it is given, then definitely it will reduce the inflammation inside the vessels, and also it will help other medicines to work faster. So definitely it can be prescribed, but the dosage has to be monitored.
Sure. And how long can we use it safely? Is it safe for pregnant? So pregnancy, it will not like be recommended as per my knowledge and experience. So better you should avoid that. And otherwise, in healthy individuals or in patients of insomnia, it can be taken on long-term basis also. Like there are several long-term studies as well. So people are taking for several weeks to several months and years also, and it will not have any issue. But yes, as far as the pregnancy is concerned, please avoid that. So great. Again, thank you so much. I think we have covered. Okay, so one more question. Low dose means how many drops or particular dosage is required? So quickly, just to add on to this, see, low dose means we can start with the minimum dose, and the dose calculation, if you are using tinctures, will be as per the age, body weight, and certain other parameters, and it is very specific and dynamic for each and every patient. So generally, for example, if we have a 1000 mg 10 ml tincture, means around 10% we are using. So we start with, if a overall average, say 35-40 years individual with 60-70 kgs of weight, so generally we start with anything between 6 to 8 to 10 drops to start with, and then gradually we can increase the dosage also, and depends on several other aspects as well. And it will be a sublingual absorption. So sometimes it can, and it's a bit dynamic. So initial some days will take to adjust the dose as per the individual. So some will have 6, some will have 8, some will have 10 drops also, some will have 12 to 15 as well, depending on how they are like positioned in terms of their history of taking another medicines, or if somebody is having history of alcohol or smoking, or some other aspects are also there. In that scenarios, we need to take it forward and justify and do the dose calculation accordingly. And sometimes patients come to us that yes, within that particular dose they are able to sleep, so that we can maintain that dose for some weeks or some months. But after some time, body adopts, and body we have seen in many individuals that a particular dose maybe after 2 or 3 months is not that much effective. So that is known as the washout period. Sometimes we have to control or maybe sometime pause and again restart, or sometimes we have to increase or decrease the dose accordingly. So it's a bit dynamic as far as the dosing is concerned in cannabis, especially in the cases of tinctures. But yes, sometimes the tablets and capsules some companies are now having, so you can start with one or two tablets or capsules as well, and depending on the response accordingly you can modify. So my request is, the more you will start practicing medical cannabis, you will learn about the dosage aspect. So it's a bit dynamic, but accordingly you can take it forward, and always start with the minimum dose in night, and gradually increase that if required. And the day dose can be start after 1 week to 10 days, if for other issues like pain management, anxiety, stress, or so some other issues. But for insomnia, for specifically for sleep, ideally 1 to 1.5 hour prior to the bedtime, in the night after dinner, it is fine that people can take, and after 1.5 hour they can expect a good quality sleep to start. So just kindly note and remember, it's not that exactly at the bed like when patient is at bed, you are administrating, because it will take at least 1 to 1.5 hour to get the maximum effects as far as the sleep induction is concerned, when being taken sublingually under the tongue, and ask them to hold that for maybe a minute or so, so that it will be absorbed in a best way possible as far as the oral tinctures are concerned. Anything you want to add, Dr. Prashant, or maybe Jahan?
It's rightly said, sir, that the dose is very, very dynamic, and we have to monitor the patient. And as per the results, we can improve the dosage. And once the doctor will start prescribing, they will calculate the dosage based out of their experience. So that is very true.
Sure, great, thanks. And Jahan, by the way, as you people are dealing with several patients and on day-to-day basis, you must be having that feedback. Any specific feedback or testimonial, or maybe any experience you want to share with our esteemed professionals here, doctors? Till now, I can see more than 100 have like are there, and at one time there were around 400 doctors who have joined this session. I know now the timings have started for OPD, it's around 5, so maybe they have like gone to that also, but initially till half an hour, 30 minutes, 40 minutes, there were around 400 doctors, and it will be there on our platform after this session also. All the links will be available. So quickly I want to just check and maybe know that if you can have some specific feedbacks or testimonials or some experience among your patients or among the people who are taking Bombay Hemp Company medicines, cannabis medicines, with respect to the sleep or insomnia particularly.
Absolutely, Dr. Piyush. Very happy to briefly shed some light on this. I think of the several thousand patients that we have helped assisted with our formulations and product over the last few years, sleep and insomnia is the second highest indication we've seen, right after chronic pain. And what we have seen is the results, as correctly mentioned by yourself as well as Dr. Prashant. When it comes to sleep, it's important to keep in mind that cannabis or Vijaya in the full spectrum is biphasic, which means that low doses optimize your what you're looking for as a practitioner and from a patient perspective, but higher doses may be anxiogenic, may actually defer sleep in certain cycles, may affect or compromise the REM in certain ways, manners and fashions. As with any other medicine, there needs to be certain degree of caution, or especially Ayurvedic medicine, there needs to be some degree of caution when actually optimizing for dosage. We normally, what we've seen is most patients follow a rule of thumb, a thumb of 2 or 3 in terms of dose titration. That means every 72 hours to say about 120 hours, that's every 3 days to 5 days, themselves and their practitioners closely work together to understand whether there is a positive effect, negative effect, or no effect arising from the dose they are at, basis which they titrate either 2 to 3 drops upwards or downwards up till a certain point of stabilization. That is the 2 week mark, or on occasion the 1 month mark, as sort of being consumed as well. And as you correctly mentioned, that a cannabis leaf extract must be consumed with a relative washout period to ensure that there is no compromising effect on the relative enzymes that say exist in your liver, or any other sort of compromising effect on biological activity, which becomes very crucial for the patient's development moving forward from sleep based issues and sleep based disorders as well. One thing we have seen, I think, particularly just to quickly touch upon, is the degree and the quantum of sleep, as well as the quality of sleep increases drastically. And what we have seen over the course of time, I think one word of caution definitely practitioners and patients is, with low doses, if results are being seen, it's important not to try and run ahead too fast and expect that results will be even better if I jump into a higher dose. The body requires time for dose tolerance, especially because we have an endocannabinoid system, as Dr. Prashant mentioned. And the beauty of what Dr. Prashant spoke about, I think, is very valuable. He began with a slide about how nabiximols specifically have shown a very good moderate use case in sleep. Now, it's important to understand what nabiximol is. It also goes by another name called Sativex. Sativex is the full spectrum extract from the cannabis flower from a company called GW Pharma, now with Otsuka Pharma, if I'm not mistaken, or another pharmaceutical company, which was 1:1, 2.7 mg THC, 2.5 mg CBD. So the as closest equivalent or mimic of what of the full spectrum is available in India was incidentally the same type of formulation used to actually generate such clinical data in the US and UK. And I think it's a very important point for transliteration and representing how global data would have significant relevance in a domestic healthcare environment. So I think that's just a brief perspective from my side. And again, I believe the voluminous information and clinical information shared by Dr. Prashant and the case information shared by herself will go miles towards educating a lot of the practitioners who have tuned in, and hopefully will encourage more questions, more thoughts, and more dialogue between practitioners to build the larger sort of proprietary Ayurvedic understanding around Vijay and cannabis as well.
Right. Great, great, Jahan, and thanks again, Dr. Prashant and Jahan, for this excellent session. I can see several doctors are mentioning that they are getting excellent results from these medicines. So, thank you so much again, all of you. Quick update, I think for all the doctors who are from Mumbai, Bombay Hem Company is having one CM in Mumbai on 15th of this month, that is on 15th of May. So, I will request any one of you is interested in attending that CM in Mumbai, please let us know, and we will be connecting you to the respective team. You all have our email ID and contact number. It's just you can write an email to us, or you can connect to any one of our team members. We have just posted our email ID, so please let us know if you are interested in attending that CME, or maybe you can just quickly post your email ID or number or name also if you are interested in that, and Bombay Ham Company will be connected to you. All the doctors who are in Mumbai or nearby Mumbai can attend that CME on 15th of May. Right, Jan? I think it is on 15th of May, right?
That's correct, Dr. Piyush.
So
That's
maybe
correct.
you can just quickly share the exact location so that people can plan accordingly if they want to join.
Absolutely. So the CME and the offline event will actually be held at the Novotel Hotel in Juhu in Mumbai. And if in case any practitioners would be interested to attend, would be very glad to connect with you and welcome you to the event as well.
Great, great, thanks. And please block your date for 13th and 14th of May because India's first dedicated exhibition on hemp and cannabis is going to happen in Delhi, and Bombay Hemp Company is our esteemed exhibitor as well in that event also. So you can meet all the Delhi doctors, the North India doctors. All of you can meet people from Bombay Hemp Company, the founders, the promoters, and their entire team will be there in the event also. So you can meet them, you can have a discussion, you can interact, you can get the details of their medicines. They are the hem partners for our 100 CR club as well. So we are looking forward to have Bombay Hem Company in many more aspects with Indian Vedyas, and we are launching our platform, that is cannabisvedyas.com as well. So I quickly ask all of you, request all of you to please be in those events. Dr. Surabhi, date for Mumbai CME is 15th of May. As mentioned by Jahan, it is in Novotel Juhu. And I think it is an afternoon CME, Jahan, right? The timings will be afternoon.
Yes, that's correct, Dr. Piyush. It actually begins at about 11:30 a.m. and
11
it'll
a.m.
till about 2 3 p.m.
Sure, sure. So 11 a.m. Novotel Juhu, all of you can note down and please attend that if you are in Mumbai or nearby areas. It will definitely a very enriched session from Bombay Hem Company, which will give you new dimensions to your medical cannabis practice. So please do not miss that. And all the North India doctors or nearby doctors, any doctors in fact from South India, I think many doctors from Southern India and West and East are also traveling for this event. That is India Hemp Expo on 13th and 14th May. So all the details are available on indiaexpo.com. If you have not registered for the conference, please do, because although the conference is complimentary, there is no fee, but the registrations are very limited, and I doubt we are very close to get the full house now as far as the registrations are concerned. So there are very limited seats available. So if you are interested, please complete your registration so that you'll be getting a seat. I think most early by this weekend we'll be blocking the conference registrations because we are already full, and all the doctors have been shown a very motivating response to this particular event. So thank you so much again for your time for this session to Bombay Hem Company and Dr. Prashant Jain. We are looking forward to have many more sessions in future with you to enrich knowledge and to gain as many tips and maybe learnings from each one of us. So on that note, I will conclude this session and see you at India Hemp Expo, and do attend the CME from Bombay Hemp Company on 15th May in Mumbai. Thank you.
Thank you so much, everyone.
Thank you, Dr. Piyush. Thank you, Jahan, for the wonderful